Hey guys, I'm Kayla and welcome to Kayla Tailored Wellness. So today I want to answer some of your most common COVID-19 questions and share my experience getting the second COVID-19 vaccine. Before we get started, smash that like button and hit the subscribe button for the YouTube algorithm. And just remember, I am not your healthcare provider. I do not know your allergies. I do not know your past medical history. I do not know what medications you are taking. So use the knowledge you gained today to have an educated conversation with your primary care provider. As of right now, the CDC is recommending that patients who've had the COVID-19 infection wait 3 months before getting the vaccine. And they may increase that to 6 months based off of recent data that suggests that 90% of recovered COVID-19 patients had a robust antibody response 8 months after their infection. Those given antibody infusions should wait about 3 months after their infusion to get the coronavirus vaccine because those infusions can reduce the efficacy of the vaccine. So currently, the American College of Gynecology is recommending that pregnant and breastfeeding mothers get the vaccine if they're eligible, but do recommend individualized counseling with their OBGYN. There were no pregnant or breastfeeding mothers studied in the vaccine trials. However, there have been studies on rats that were pregnant and breastfeeding and found no safety concerns. Those who are immunosuppressed and are taking immunosuppressants such as prednisone are still recommended to get the COVID-19 vaccine because of their risk, and they're still expecting to have a robust immune response with this vaccine. Because we've only been studying this vaccine since the summer of 2020, we don't know how long the antibodies will last, but at this time we do not have any recommendations for a booster dose. Currently, the vaccine is protective against symptomatic and asymptomatic infections. Findings from population-based studies found that people who have COVID-19 and without symptoms are less likely to transmit the virus to others. Many vaccines we commonly give protect us against getting the disease and transmitting it to others. Currently, the contraindications include having a severe anaphylactic reaction to a previous COVID-19 vaccine or any of its ingredients, an immediate allergic reaction to any severity of the COVID-19 vaccine or any of its ingredients, and an immediate allergic reaction of any severity to polysorbate. Having anaphylaxis to any other vaccine is not a contraindication to get the COVID-19 vaccine. I would not take Tylenol or ibuprofen before getting the vaccine because it can blunt the vaccine-induced antibody response. However, if you're having arm pain, body aches, fever after you have the vaccine, then these can be effectively managed with those medications. Currently, they're recommending 21 days from your first Pfizer vaccine to get your second dose and 28 days from your first Moderna vaccine to get your second dose. But they are allowing a 4-day grace period for that second dose date. However, until we know if this vaccine prevents asymptomatic transmission, then we need to still exercise caution and wear our mask and stay 6 feet apart. Some patients are developing redness and itching at their injection site 7 days after they got the vaccine. And this is called the 7-day itch. It's just a delayed allergic response. Although the Moderna vaccine doesn't have to be stored at negative 70 degrees Celsius like the Pfizer vaccine, it does have some challenges with administration. As you can see on the vial, it is recommended to provide 10 doses. However, there is usually enough suspension for 11 doses. The issue is that the vial can only be left out for 6 hours once it is open, so it is challenging to coordinate the correct number of vaccine participants. Also interesting, nurses administering this vaccine cannot shake the vial. It can only be swirled before withdrawing doses. So it is now 5 hours since I got my COVID vaccine. I am feeling good. I have good energy. I don't have any nausea, changes in appetite, changes in energy, no sore throat, no fevers. I'm feeling really good. And as far as the injection site, it looks really good. There's no redness, there's no swelling. It's slightly tender, but I haven't really noticed it this afternoon. So I should get full protection, like the 94% protection in the next 10 days. So I still need to be careful and wear my mask and socially distance. And then I do need to just monitor my symptoms tonight and tomorrow especially. They have noted that patients who have COVID antibodies have worse symptoms from the vaccine than those who do not have COVID antibodies. So hopefully I'm in the clear with that, but we will see. And then I just have to make sure that I don't get any other vaccines over the next 2 weeks because that is contraindicated with the COVID-19 vaccine. So I will keep you guys updated on how I'm feeling. So it is now 24 hours since I got my vaccine. The injection site doesn't have any redness or swelling. It is slightly tender to palpation, but I would say that the first Moderna vaccine left me with a sore arm than I do experience today. Last night I slept great. Today I feel normal. My colleagues did mention that they had fevers, chills, muscle aches, headaches, and fatigue, but nothing that a little Tylenol didn't help. Before I got my vaccine, I supplemented with probiotic, vitamin C, zinc, vitamin D, elderberry, echinacea, garlic. Just really wanted to boost my immune system and prepare for the vaccine. So that could have been the reason why I feel so good. I'm not sure, but I'm just excited to be done with my series and help with getting us herd immunity. So that's all I have for you guys today. Please follow me on Instagram at Kayla Tailored Wellness and comment below. Let me know how your experience was getting the vaccine. And please check out my description below for competitively priced supplements. And thanks again for letting me tailor your wellness.